All right, this is Anna. She's an ultrasound tech, so she experiences some wrist and shoulder pain and occasionally some neck pain with her job. So we're going to break down some assessments and treatments that we would do for this kind of thing in the clinic. Anything else that you feel bothers you pretty regularly with working as an ultrasound tech?
No, just neck, shoulder, and wrist. Just this.
Okay. So we're going to break that through. First thing we are going to look at is some shoulder range of motion. So I'm going to have you go ahead and turn away from the camera all the way.
Oh, sorry.
And then we're going to do one arm up and over like you're combing your hair. Try to touch the other shoulder blade. And she did pretty good at not cheating there, but we coached her a little bit on this, and earlier she kind of ducked her head out of the way trying to get that arm and clear some extra movement. But she got pretty close to where we'd want her to get, right at the corner of that shoulder blade. Let's do that right one more time. But you can see the movement's not super clean. There's a little bit of restriction. It's kind of clunky as it makes its way over. And now let's do the left. And that one, she's really having to rotate a little bit through the upper back to get to that point. She can get there, but not without some compensations. Now let's go with the next one, where we were behind the back. And we're looking for one clean, solid movement where she can get to the shoulder blade. We don't want to see a lot of winging at the shoulder blade here. Let's come back down. We'll do that right one more time. And you can tell it gets pretty tight there, but she's still able to kind of muscle her way through it, but not without a little bit of winging here in that shoulder blade. Let's go in the other one. And that one looks worse to me. The shoulder blade's definitely pointing straight back at the camera there, and she really had to kind of torque her arm to get that back there. And the shoulders lay on the foundation of your upper back and your rib cage, so we're going to screen for some thoracic mobility next. So I'll have you on the table there, sitting back on your feet like we did earlier. Okay, so we've got Anna here in this lumbar locked position. So I've got her sitting back down on her feet, and then that's going to take out some of the low back movement so that we can see how well she is now rotating through the upper back, the thoracic spine. So from there, Anna, go ahead and put your right hand behind your low back.
Oh.
Yep. And then I'm going to block her here actually with my hip, with my hand, so that she's not cheating, because we've already seen a little bit of that. She's kind of stiff, but good at getting around those stiff parts. And now go ahead and rotate. Turn towards this shoulder, rotate up as far as you can. I want to see her get to about 50 degrees of rotation there. And we'll go again. And she's pretty tight there. Definitely she's able to force it a little bit, but it's pretty restricted, not getting easily into that range where we want her to be. And when the thoracic spine is restricted, that can lead to some shoulder issues. If you're not moving well through the upper back, then the shoulder is going to have to work overtime. So a stiff upper back can lead to a hypermobile shoulder, and it can also lead to some of those neck issues also, because your neck sits on the foundation of your upper back, your thoracic spine. So let's go up there, right hand again. Now I'm going to see if you can do this passively. So I'm going to move her now. So I'm going to reach into the shoulder, just relax, and I'm going to rotate her. So actually pretty good there. So we know she has the mobility for it, but she doesn't have the control. And now let's go to the other side. Scooch over towards me a little bit so your hip hits mine. Good. And stay sitting back there. And then left hand behind your low back. Try to rotate up on this one. A little better. I'd say you almost even get into that 50-degree range here. And then we don't need to check it passively because we know you can get there on your own. So we've checked out the shoulder, we've checked out the upper back mobility. Now we're going to check some more of the neck movements here. So I'm going to have Anna go ahead and drop your head, try to touch your chin down to your chest. So go ahead and go there again. So if I'm holding she's about 2 fingers away from chin to chest position there. So normal range of motion is able to touch that chin down all the way to your chest. You can see I can almost eat the microphone there. I've got pretty good mobility there. And now I'm going to have you turn back that way. Now up towards the ceiling as far as you can. And so we'd really want to see Anna getting a little bit further than that. So you would look at the chin to forehead line. You want to be about to 80 degrees, which is 10 degrees off parallel there. And now go ahead and turn your head towards the camera as far as you can. So I'm looking to see that she can rotate to get to her chin to about mid-clavicle. So middle of the collarbone, I've got my finger there. Can she get there with her chin? Not without a little bit of pain, actually. And then we're going to turn, we're going to do the same thing the other way. And turn again. Should basically be able to look straight into that camera. You're close, but I'm being picky. I think that you can do better. And then one more shoulder movement from here. Just keep the elbow straight, thumbs up, go up as high as you can there. And we can see her left shoulder actually moves a little bit further than the right. And so we'll break that down with some of the soft tissue treatment later. You can usually make a pretty big gain on that pretty fast.